All right. Good morning, everyone. Welcome to the June Brooklyn DD Council meeting. This is our last one of the council season. We start again in September, so keep an eye out in August for schedules and updates, membership information to reopen paid members, and any other events that we're going to plan next year. So I just want to start from the council. Thank you to everyone that helped support the fair last week, everyone that showed up. I haven't tallied all the numbers yet, but it was one of our biggest events. We definitely had the most agencies participating. We had 77 agencies in total show up. A few didn't appear, but 77 is our highest number as of yet. We had great attendance throughout the day. Thank you to OPWDD. You guys did a front door session for us. That was great. Thank you to all of our sponsors. Um, all of our sponsors are linked on our website as well, so you can check them out if you were able to meet them and want to get more information. Go to our website, bkddcouncil.org, and you can go directly to their websites to connect with them directly. It really came out great. The photo people, everything. It was just a very positive day, and hopefully everyone that showed up got a lot of great resources, not just all the swag, but actually the information about the services. Um, and hopefully everyone had a good time. But if you have any feedback and you want to share it, please email me on the side, and we're always looking at ways that we can improve future events. So thank you to all of my chairs and vice chairs and everyone on the council that helps get all that together. It really turned out really nice, and it definitely helped that it was before a holiday, so we all got a little bit of a longer weekend after getting through that day. Um, That being said, like I said, this is the last meeting of the year. We do take off the summer. I will continue to send out any news, flyers, anything like that that agencies share with me. But we don't meet unless there's some kind of craziness that goes on. We can always schedule a meeting for whoever's available, but we don't typically have any scheduled meetings for July and August. So we'll reconvene in September, and you'll start seeing information towards the middle of August about the upcoming council year. That being said, is there anything from any of my chairs, the committee chairs, anything like that that they want to talk about before we pass it over to Nina and OPWDD? Debbie?
Okay, first I want to say that I'm really glad that for the last year, Rosal and I were able to get a lot of different subjects to help on the provider information. And we do want to continue doing that. And because we found that the more we try to help the care managers as well as the staff and the parents and everyone, it's been working. So I'm glad that, we she and I are still going to work together. But as I said, if Sheena, both you want us to do anything else to help, please let us know. Because with changes coming down from the feds, we all have to be ready. But I just wanted to let you know that the last year we got a lot accomplished with our meetings. So I wanted to bring that up. And I hope we can, if we have to piggyback with another committee, please let us know. But otherwise, we were happy, and the fair went great. I'm putting my official 2 cents in. The compliments, everyone was like really happy. And I have to say, even the Brooklyn College, the men who put the tables and chairs together, they said thank you again because we also kept the place neat and clean, and they found us very easy to work with. So I forgot to tell you, they said thank you.
All right. Anyone else want to chime in from the council? Any updates, any news on behalf of the council? No? All right, so I will pass it over to Nina. Thank you for being here, Nina. And again, thanks to you and your team for not only having a table, but also doing our front door presentation. It was Contessa and, oh my God,
And
I'm drawing a blank.
Brian, we had a team. I know we had a team. So thank you, and thank you to the entire council for organizing this event. Each year and being so strong, right? And most important, connecting families to the services that people need. There are so many options out there that people are just not aware of or afraid to call or to reach out. So thank you. I also got a very, very good feedback and positive vibes from our staff who were there last week. So, and with that, can I start with my OPWDD update?
Yes, please.
Okay. Okay. So, good morning to everyone. It's a small group today, but we do have the updates that I try to share here in each meeting. So first, the recently enacted state budget includes several important investments into OPWDD services. The budget provides approximately $290 million for a 2.7 targeted inflationary increase for providers and $78 million to support minimum wage increases. It also includes a 5% increase to family care rates, and budget also includes additional resources for data and reporting and continued investments to help people to access and navigate our services. In healthcare, OPWDD has started awarding funding through the 25 million Healthcare Accessibility Initiative. 30 organizations across New York State will receive funding to improve access to healthcare for people with developmental disabilities. And this includes a $5 million award to NYU Dentistry's Oral Health Care Center and other projects that will expand specialized healthcare services statewide. OPWDD continues to expand support decision-making services, and this approach helps people make their own decisions with support and trusted individuals that they choose. It promotes independence, choice, and self-determination in making decisions in their lives. OPWDD has also launched the new Home Enabling Support Service. I spoke about that many times. This is a waiver-funded service that provides technology that can help people to live more independently in uncertified settings. You have to be waiver eligible over the age of 18. And examples of home enabling support services include remote supports, medication dispensers, sensors, and other assistive technology. 8 providers throughout the state were selected for each reason. For each region in New York City, we have PCCS, and I think ADAPT. I'll have to check that later. And finally, I wanted to mention that at the last FSS meeting, there was a discussion about the family support services and the RFP that was released last year. And the OPWDD found inconsistencies in the review and scoring process. And it was determined that the procurement should be reissued. And the goal of this new FSS RFP will be to simplify the process, to strengthen regional input, improve reviewer trainings, and ensure that a fair and consistent review process is established statewide. So OPWDD has also identified an additional $4.1 million in funding. And this brings the total funding that will be available through the upcoming FSS procurement to approximately $7.6 million statewide. So those are my major updates from OPWDD, and I'll be happy to answer any questions.
Thank you, Nina. Does anyone have any questions for Nina? Rochelle?
Hi, good morning, Nina.
Okay.
I just wanted to ask a little bit about the FSS RFPs. I just heard about it the other day. And I guess what surprised me was I was told that there wouldn't be any adverse impact on people who needed the supports. And I was a little honestly baffled by that because it has been a very prolonged process. Providers had to resubmit RFPs a number of times. This has been going on for a while. And so I don't think it's having an impact on people who are already hooked up with agencies and, the agency still had some funds left to assist them. But, nobody has a contract now. So how do people who are in need of FSS supports right now until the RFPs are redone again and authorized again, how do families get, the services that they need through FSS? So that's really my question.
As far as I understand, the funding is available, right? The existing funding is available. And we were talking about additional funding rolling in and inviting additional proposals, additional agencies to participate in the FSS RFP. But I can take your question um, and ask follow up with our FSS team because
Yeah,
I'm not in that area anymore.
I know. I get that, but and I'm not just asking as a single person. I've heard this from many, many different people. So I think it is a major concern. And then, the fact that there's basically a moratorium right now on the new agencies getting their contracts limits the number of providers in particular areas and just makes it that much harder for families to access the services. So anyway, any insight you can give on this would be appreciated.
I'll take your comments and I'll have to get circled back. And maybe Deborah has more updates on this.
Okay, the biggest updates we have are this. First of all, we know that the current RFP, all the providers that participate should have already received their letters, whether they're getting it or not. We did request the statewide advisory council with the rest of the statewide members. We asked about the questions and the priorities. Do we have, because we will be knowing we're going to do another RFP soon, but we weren't given the date or the time yet, Rochelle. But there are still family support programs there that, because in some programs you're only allowed to have a certain amount of people on for a while on the list, and then you have to rotate and do other families. It's very, I do understand the families' issues because at the fair I was constantly asked, and I did ask them when they have problems to email me and whatever questions we cannot answer. Of course, I forwarded to the family support team at our local Brooklyn DDRO, as well as I make sure I CC Nina and the others, but we're working very hard to make sure family support services are going to be solvent and be able to be used. So this is all I can say at the moment. I'm waiting for the rest of the answers that we'll get next month because we do understand the frustrations. Also, the other person was big help to explain things was Denise Alton. She did come to the advisory council's meeting, and there was, let's just say, the way the RFPs were done this time were a little different than most of us were used to. But we're waiting for the answers. We know also right before 4th of July, and also because in New York City we have our fiscal year changing, but we're waiting for answers, and as soon as I know, I will let everybody else know. Fair, did I say it right, Nina? Because I'm being careful, but I'm telling you, we are all the advisory councils, we're on top of this issue. But we can only do so much. But we are not backing down. And we're also making sure that the members of ours that go to the DDAC committee, DDAC council, are there to voice their concern also. And we have let our statewide coordinator, Nick Hobson, know too, as well as New York City. Okay? I hope I answered some of your questions, Rochelle.
I appreciate your advocacy on this. Deborah. I said, I'm just trying to convey what I'm hearing from a lot of families.
No, I appreciate you saying that, but I'm just also letting you know that I've taken what you're saying very, very seriously, and we're trying very hard to make sure we're trying to keep family support services intact to the best of our abilities because it does make it easier. There are people don't realize there are many families who don't want to do the Medicaid waiver. They like doing the straight family support services, and we do let them know they can if they choose to, as long as the child's living at home with them or another family member. And they're pretty open-minded. I mean, the one issue we keep getting is what's allowed for self-direction, what's not allowed. But I'm not a self-direction broker, and we try to keep everything what's family support. If we have questions or answers, I always refer to either like Robin Mooney, Brian Watson, even send it to Andrew. We let everybody know what if we have questions. But I appreciate you found out too, because we have to make sure we get help for these families. Thank you, Rochelle, and thank you, Nina.
All right. I don't see any other questions for Nina. If you do have them, you can put them in the chat or email and we'll get it to her. Thank you again, Nina. Appreciate you being here, as always. Again, as I mentioned earlier, IAC wasn't able to have someone available to come today, but they did share notes from their most recent provider association meeting from June 15th. So some of the stuff Nina covered already, so I just want to look through real quick to highlight some of the other points that were included from Winnie at IAC. So she had a note on the an ombuds report that was released that they had received 194 calls on the helpline and 300 plus email inquiries, helping people with access, eligibility, quality of care, and information to understand the system. And if you guys remember, a few months ago, we had the ombuds program come on and do a presentation. It's on our YouTube, so you can go back and rewatch that if anyone's looking for additional support. In addition to what the CCOs and OPW can provide, it's a great program that was started to help out. There are future planning forums that are being planned across the state. 2 in-person, 1 virtual, I believe. And I have that email that I can share out after the meeting as well. I'm a little behind on emails due to our fair last week, but I'll definitely get that out to everyone. June is Disability Pride Month, and there will be a celebration on July 8th in the Plaza and FIFA Watch Party events. And I believe OPW shared some of that out. Upcoming regulations and administrative directive memorandas, ADMs. There are 2 regulations affecting OPW as part of the Governor's Express Initiative. Under Regulation 633.9, Representative Payee, the change reduced the numbers of people who need to be provided written notification to justify the beneficiary's legal guardian, and anyone designated by the beneficiary. Another change for when someone moves from one agency to another. The former agency previously had to send 1 month of statutory personal allowance to the new agency. This has been changed to 4 months or the total of the person's funds, whichever is less, before returning funds to SSA. Under 633.15 Personal Allowance Regulation, providers previously had to keep receipts for payments under $15. That is now changed to $25, and also had to send a copy of the personal allowance ledger to payees every quarter. This requirement has now been removed. There will be more details coming out after their regulatory stakeholders meeting. Another note on an ADM, housing subsidy ADM will be finished soon. Highlights include changes to the types of facilities where people can use housing subsidies. More designed for people with IDD includes a prohibition for provider-owned or operated housing. It will outline the rights of people to select the providers and housing type, increases approvals to 180 days, dispute resolution up to 30 days, can request an appeal for 30 days. It will also be discussed at the stakeholder meeting. Provider-owned does not include ISH projects, and OPW is close to releasing the new Assistive Tech EMOD VMOD policy manual with improvements. They provided data on the CAS system. I know there's a lot of talk going around the CAS and a lot of concerns going around the CAS, but they released data from the end of May. 88,956 people have completed a CAS. Over 50% of people have a current CAS in the system. Over 49% are due for biennial assessments. And then they provided data on the CANs. 36,613 completed the CANs, 86% are current, 14% are due for annual reassessment. 5.6% of people do not have a finalized CAS or CANs. Current CAS is not needed for the targeted inflationary increase adjustments on self-direction budgets. Priority assignments for assessments can be requested and are often completed within 7 days, in no more than 45 days. You have the option for in-person or virtual. Day, evening, and weekend hours are available. OPW is working to ensure that people in certified residential opportunities are assessed, created an expedited queue for residential, 33,566 people in certified residences. Of that group, 42% of adults are current and 74% of children are current. OPW is tracking data monthly to ensure a continued upward trend. Regarding Medicaid recertification challenges, OPW has collaborated with DOH to develop a plain language summary for families and care managers. And provider associations are working along with OPW to collaborate to ensure that people are not dropped and that all parties are included in the conversations to avoid recertification challenges and issues. Another highlight or bullet that was on the report from IAC, CCO evaluations, work plan for phase 1. OPW convened a work group with the CCOs. There were 67 recommendations categorized into 4 buckets: strategic ideas, immediate action, rethink or defer, and further evaluate. Phase 1 has 21 recommendations grouped into 4 program types: waiver enrollment and service access, policy procedures, training, and technical support. 7 of the 21 are specific to OPWDD, 7 are specific to CCOs, and 7 will be worked on jointly between OPWDD and CCOs. Implementation plans are being developed. There are 2 completed projects. They will begin meeting on a regular basis and will share their status of work. And that was the highlights. If anyone has questions, again, I was just reading from IAC's report. You can email me and I will try to get details and further clarity from them. But that is all I have from IAC at this time. Debbie?
One thing I'm very, very happy you said, that they're going to give us simple instructions for the reference to when you have to recertify the Medicaid for your child who gets services, and also because the basic Medicaid, you're not supposed to have more than like 900 or something dollars per month. But many of our children, because they were disabled before the age of 22, Social Security puts them up at a higher. But thank God, our Medicaid, off the main one that I only go to, you can renew your Medicaid there, where you don't have to worry about a spend down. I hope they add in that our kids are DAX and don't put the spend, and make sure they understand our children don't have to be a spend down unless they made more money than mom and dad. Then they have to. I did check this with Medicaid, Maria Ortiz Casada, as well as HRA, because even Jennifer Schultz told me the same thing. So,
Okay.
but thank you that's a great news to hear. Thank you.
No problem. All right. So that was it from IAC. I don't believe we have a rep from DOH on for any updates. I didn't see Rihanna or anyone. So we'll keep moving along. Like I said, today should be a pretty short meeting. Debbie, do you have any additional updates I know you have Chris's update from the MTA.
Yes,
Anything else for the
yes.
family support? Go ahead.
Okay. First of all, I want everyone to know what I basically spoke with Nina about. We did discuss, we kept it very short to the point about the RFP, because at the statewide it was addressed, but we are waiting for more answers to come back. We do know that who did do the RFP should have gotten their letters. If not, I suggest you contact in Region 4, either Nina, Denise Alton, but also let them know up in central office The other important thing we're talking about was with the ADM reimbursement. Now, we know that there's some issues with it, and some of them are very successful. We want to know if something that used to be on the allowable list all of a sudden became to the non-allowable. We would appreciate, and I'll give you a very fast example. In Region 2, which is right near us over in the Catskills region and stuff, they have what they call trampoline parks. And many children in the autistic spectrum or neurological issues, they find it's really helpful because the kids bounce out their energy because to set up a trampoline in your apartment that's safe and enough room is very hard, even in houses. So now they started to turn them down, and the families with the agencies in that area really got upset. So they're advocating to have it taken. They're doing correct justification. So example, also, if you find your child wants to go to you love going with your child to the zoo or a farm program or certain museums and they turn it down, please let us know and we will help you we're trying to figure out what they're not allowing or allowing, because they even admitted to us they want to get things off they want to get some more stuff off the non-allowable list. So I'm not rushing this because we have all summer in the advisory council. We're not going to officially be meeting until October due to the Jewish holidays, as that's also, I'm going to do the report also for the provider information was also, we're going to not start until October for us. But I also want to tell you, since next month is the celebration for the ADA 36, we are going, as you know, Brooklyn partnering with Carrie Banks from Inclusive Services on Friday, July 10th from 11 a.m. to 2 p.m. We're at Brooklyn Heights Library, which is 286 Casman Plaza. We're having our resource fair, and we will be discussing. If you have any questions, we will have OPWDD. We have all whatever agencies we have. Also, bring the kids because we will also be doing an arts and craft activity for the children, so bring the whole family. Also, they've asked, please do not wear perfume, cologne, or other scented products while using the space. We have many people with allergies. But also, I want you to know all 5 boroughs are going to be celebrating the ADA 36. And they'll be on the 8th is, I hope I get it right. I know that Brooklyn Borough Hall is doing theirs, not at Borough Hall because their elevators out there, and it's on our website. They're going to be doing it also at Brooklyn Heights Library. And the Bronx is doing it. We know Queens and Staten Island will be doing. I don't have those dates yet, but they will be on the advisory council's website, and we share everything with Brian. Also, I want to say that I'm going to give the quick MTA report. I want everyone to know that Nevin Street Station, where the 2, 3, 4, and 5 are, is going to be made accessible. And that's because there's a lot of buildings around over there. They're building. And there is now in all 59 community boards. If you're going to be building a new home or or building, whatever, right by the train station, and if you agree to make that station accessible by elevator, ramp, or both, and help with the other forms like tactile strips and stuff, you'll get major tax credits because it has been approved by the city, state, and even the federal. So we're really pleased that I don't have the name of the company, but they are going to make sure that that station will be accessible. So that brings it even to another one, because that's a major transfer point, because it's easier to cross over from the local, like if you're on the 2 and 3 and you want to go to the 4 and 5, because you don't have to worry about going down an elevator, going to another one to go up. Just cross the platform. The other thing we also want you to know that there will be, right now, we're requesting advocacy to we need more updated Omni reduced fare buses to make sure that it'll be easier for people to sign up. Chris wants you to know right now the MTA committee meetings are today, Monday, June 22nd, and Wednesday, June 24th is the board meeting, which will be at 2 Broadway. You can, if you don't want to go in person, you can click on early because they start the public session first. And you can always get that on the Brooklyn Family Support Advisory Council's website, which is www.bfssac.org. That's it. Thank you, Brian.
Thank you, Debbie. Does anyone have any questions for Debbie?
This is Carrie. I just read that article this morning about Nevin Street, and the company involved with funding the accessibility changes is Development Rosie Tilley. I put it in chat. I'll get there, folks. Just a little more caffeine.
Thank you, Carrie. And if anybody knows companies that are willing to they're building near a station, they want to make it accessible, they should contact the MTA. Thank you.
All right. Thank you. Angela?
Hey, good morning, everybody. I'm glad
Good
this
morning.
fair worked out to be wonderful. I'm hearing great things about it. I think you all did a wonderful job. I'm sorry I
Thank you.
couldn't make it there, but congratulations to everybody. Just a reminder, we're getting to the end of our fiscal year for reimbursements. So we need to remind the agencies and the families to get your applications in by the June 30th date. Again, July 1st starts our new fiscal year, so just a reminder to get that stuff in. That was it. Oh, the guide is done. I'm sure you saw it at the fair, and thank you for posting it. And again, I mean, we did it as best as we could with the information we were provided with at this time. So there may be some updates needed for next fiscal year, but we'll cross that bridge when we get to it. Thank you, guys. Have a good day.
Thank you, Angela. And if anyone is interested in the family support guide that Angela helped put together, it is on our website. It's on the Family Support Advisory website, and it was also available at the fair via a QR code, I believe. All right. I don't think we really have anything else on the agenda except for announcements. So I can open up the floor. If anyone wants to come on, give announcements, please do the hand raise and I will go through as I see it pop up. And the first one is Doris. Doris, you're muted.
You are muted. You hear me now?
Yes.
Oh, great. Okay, my name is Doris Kahn, and I'm the outreach coordinator for New York State Institute on Disability. We're a family support agency. I want to congratulate everybody who put together that wonderful fair that we had last Thursday. And I was very impressed with the heterogeneity of the attendees because we had parents, we had care managers, we had teachers, we had individuals representing themselves. And so it was a mix of people, and that was great. NYSID provides camp reimbursement. Summer is here. Parents can if they have a camp they want to send their child to, it has to be within New York State and it has to have a Department of Health certificate. They pay the camp and they could send their receipt and fill out an application, send it to NYSID for reimbursement. I posted the flyer and more information about that in the chat. Thank you. Everybody have a good summer. Thank you.
Thank you, Doris. Ernie?
Hi, good morning, everybody. Yeah, wonderful fair. Brian, you and I were chatting. It was really great diversity, like Doris is saying. So many folks and so many great conversations. Having having different rooms and different places to explore, I think allowed folks to have nicer one-on-one conversations and not to feel too overwhelmed, I guess. I don't know. Anyway, so people were just kind of at my table all day long. I couldn't get out and see everything until it was over. Basically, but I had a great time, and I was able to introduce folks to my health and wellness coaching and really talk about how I support people with chronic conditions. We're talking hypertension, heart disease, diabetes, prediabetes, obesity, and many more of those conditions can be addressed and managed best with simple but powerful lifestyle changes like improving the way you eat, way you move and exercise, getting better sleep, managing stress, which is important, and making social connections, which is a wonderful part of the fair. Provider agencies can contact me to find out how we can partner to collaborate on how to best support people and help remove those barriers to change. Also happy to work with care managers, families, adults with disabilities to discuss my personalized coaching services. I'll put all my information in the chat, and congratulations, everybody.
Thanks, Ernie, and welcome back to the group.
Thank you.
Any other announcements? This might be a record meeting in terms of time.
This is Carrie. Turns out
Go
I do
ahead,
have
Carrie.
something I want to announce. So every summer, the libraries in New York City run what we call summer reading. And summer reading is a way to celebrate reading over the summer and started as a way to keep kids involved in summer, in reading during the summer. But it's really evolved into much more than that. And this year, as in past years, we are including adults as well as children and youth. This year is a very special year, I think, for us, meaning the council. The theme in this year's summer reading program is everyone has a story and tell your story. And one of the things I think is that the folks that we represent, the folks that we work with, and those of us who are adults with disabilities, people don't ask what our stories are very often and don't record them either. So please think about this in the library, connect with the library's summer reading, or don't connect with the library's summer reading, but please share your story and encourage the individuals in your life to share their stories, whether they're recording something or writing it down or illustrating it with pictures. Let's take this opportunity to share our stories and be heard and listen to others. Okay, so a little off my normal sort of topic, but there you go. Summer reading at the library. Share your story. Thank you.
That's great. Thank you, Carrie. All right, last call for announcements.
Hi, this is Zadine from Inclusive Services at the Brooklyn Public Library. The two announcements I placed in the chat, which is the upcoming fair and the upcoming one-to-one. If anyone needs any additional information, I'll be more than happy to email it out, but I did put the information in the chat, please.
Thank you. And that'll all be posted on our website and our YouTube, so anyone could access after the meeting as well.
Thank you.
All right, I think. Oh, Doris again. You're muted again.
Yeah, could Ernie put his email address in the chat, please?
Yep, he just
Yeah.
did.
Oh, he just did. Sorry.
Yeah.
Oh,
No
now,
worries.
okay.
No worries.
Okay.
I'm limited to 1,000 characters, so I had to make it a little shorter.
Oh,
and
you
then
wrote
I
the whole
clicked it.
thing there.
Yeah.
I just want your email. Okay.
It's there. All
It's
right.
at the bottom. All right, so I think that is it for this council year and for this meeting.
Oh.
So thank you again to everyone who participated today and throughout the year and who attended our event. Thank you to all my chairs and my co-chairs of the committees. I appreciate all of the support throughout the year, as I'm sure the Brooklyn community does as well. And we'll look to come back bigger and better next year.
Okay.
So thank you, everyone.
Thank
Have
you.
a great summer.
And
You
have a great
too.
summer, everyone.
Thanks, everyone.
Have a
Have a
great
wonderful
summer, everyone. Take care.
Take
Be
care.
well, everybody.
Bye.
Bye.
Great
Bye.
summer.
Bye.